Hi, thank you very much. I was lucky. I got to sit with some really experienced people, and we were discussing the particular location of Staten Island. So, I understand. So so those of us who are New Yorkers in the room probably are aware that Staten Island is a place that many people often don't go to, or maybe there hasn't been always a lot of attention to what's going on in the island. And part of what was being discussed is that the disparities on the island and cultural differences and how those can be addressed. And I think at a deeper level, what I heard from a few people is that there's a need to help people learn to talk about death. And that includes religious leaders and clergy, various types of individuals who are professionals in the religious realm. And we know that society as a whole, the idea of death is not being discussed. So this came up as how do we get faith leaders to engage in the topic. And part of the idea, among the ideas that were being discussed is that an event doesn't change the system. Like having an event is a good thing, but what's really needed is some sort of a series of kind of productive environments where maybe religious leaders and faith community leaders could come together and kind of create a peer group where they start to learn how to talk about death, maybe over 10 sessions. So we were also talking, those of us who have been trained in some sort of a chaplaincy role, maybe having more comfort with this, but there's a bit of a siloing within the field of religious life around who can have these conversations and who can't. So we were talking about some practical ideas there. And we also talked about pain management and that being more than medication. So trying to figure out how to pull people into the conversation, how to create a safe space for them to have the conversation, and then not to ignore the diversity issues and the kind of the differences of care, the differences that people are experiencing on the island regarding whether or not they're getting access to care and whether or not people in Staten Island are leaving the island for medical care because they feel that they can get better care in a different location. So these are some of the things that were being discussed in our group. I hope that I represented well.
Okay. Thank you, Maggie. Are there any questions of Maggie before she goes? Any questions?
Who was the Staten Islanders on your?
Can I have my Staten Island people
I
please
lived there
represent?
for 30 years.
You want to see who?
I want to hold up the fact that one of the representatives who may not have left, was actually the son of someone who passed away last year and heard about this conference. So I think it's quite remarkable that a family member would come out, and then it really came up for me, how do we bridge a conversation where people from the community who just simply have walked this, even in recent years, can come forward and help us all as leaders understand how to talk about it. So.
Thank you, Maggie. Next group? Anybody from the next group? I know our group's changed a little bit, so.
Hi, I'm Jim Siegel from Healthcare Chaplaincy Network, and I'm going to try and represent Group 3, and I'm sure if I leave some stuff out, John will pipe up and talk about. We talked about Staten Island as well, and specifically talking about linking with a grassroots organization there, and Doctor talked about Project Hospitality, and which has become an organization which, and I hope I have it right, which originally was starting out by somebody who was providing sandwiches for the homeless as they were getting off the ferry or congregating around there, and has grown into a $150 million healthcare and educational delivery organization. And the theme that we had was not just in Staten Island, but also John talked about Kaiser. Is everyone aware of Kaiser Permanente, the major integrated healthcare delivery organization? It's not just California, but in certain places around the country. And how, and CTAC has been involved, and I hope I haven't explaining this right, but in East Oakland, coming out of a similar brainstorming session as what we've been having today, the faith-based community said, how can we work better together? And Kaiser has funded an organization where Kaiser has funded a patient navigators aligned with faith-based community, and you're not, the doctor talked about what are HIPAA rules. Well, there's consent for working on a grassroots basis in terms of being able to provide better healthcare, better information. I mean, we're not just talking end-of-life care, we're talking about earlier in the spectrum. So what a theme that came out of our group was talking about, okay, if you've got, George had mentioned the Gary Gunderson in Memphis, there's a major portfolio of faith-based organizations providing similar kinds of services. Malcolm Marler, who is the head of chaplaincy services at University of Alabama, Birmingham, George also mentioned. I work with George, that's how come I know this stuff. But if there's a way to sort of start on a grassroots basis, top-down is not going to work. I mean, and that's, top-down is certainly not going to work. But if we can identify different examples of grassroots organizations where people can then, from a bottom up, and then get foundation or payer funding, and if not just government funding, but in terms of, I mean, the major payers, the major healthcare insurance companies know things are changing. So they can sort of fund grassroots pilot tests. Pilot tests is a way to make it happen. Similar discussion in terms of trying to inform people, and basically we're not going to solve it all at once. But if each of us can work with different kinds of organizations to try to sort of create some grassroots sort of programs. There was, Sister talked about, and forgive me if I have this wrong, but church in Central Harlem where parishioners are encouraged, if they're going to the hospital, to call the church office, and where a priest or deacon will visit with them. It's basically doing it on a parish basis. Another issue that came up was something that John raised, which is sort of from I'm Jewish, but I work for a multi-faith organization. I went to Catholic school. If you wonder if I'm very and but within the Jewish community, I don't think about, I'm a member of Central Synagogue, a fabulous 2,000 member synagogue here in New York. I know if I needed spiritual care, I could contact the clergy. But if I think about healthcare, and maybe a minority of one from a Jewish perspective, I would think about who would I ask? I'd ask friends. I wouldn't be going to a synagogue. And that was something that John raised, something that Rabbi Richard addressed. Raised, which, so if you think about culture, you think about, okay, who would I go and talk to? Have I missed any important points? Oh, one other point, Doctor talked about a number that terrified me when I heard about it, that I think terrified all of us, that the average cost for one night in New York hospitals that's billed, not necessarily paid, is $7,000. So if you think about somebody who doesn't have health care insurance, so did I miss anything?
Any questions of Jim?
That I could possibly answer.
Yes.
No, I just want to add,
Staten
Staten Island does have a community organizer who was supposed to be in the meeting today. He's in the list that has been shared with you, number 27, Hisham. He is a community activist who is very much involved in the local communities, in Muslim communities, the mosques and so forth. And I'm sure we can recognize community activists in these communities who work with immigrants, who work with the disadvantaged or those who cannot be heard with. And I think through them we can then reach out, and if you partner with them in terms of health screenings and advanced directives, which we thought was very difficult to reach out to those who are looking for bread. A sandwich at the end of the day, they're not going to be discussing with you advanced directives. But at least if we have people that we can identify who are community organizers, and through them we can reach out and then reach out to faith organizations, perhaps that can be a connection.
Great, thank you. Now group 3, and I forgot the other group, the number of the group, but 3?
Tyrone, we were 3.
Yeah, but the other one.
That
Oh,
was
okay. 9. 3 and 9. 7.
So we were actually groups 1, 2, and 6.
Oh, okay.
We've already started our collaboration. And I just wanted to mention that for all the people here from Staten Island, we didn't think you were going to come. So we're doing a similar type of program in Staten Island on November 11th. So please join us for that session also, which would be really wonderful. And we are doing it with program hospitality too. So a couple of things. For our 3 groups, we have a lot of creativity in this particular room. We have St. Luke AME, which has a very active take care of your business program, which is really an attractive model, and they really urge the parishioners to make sure that their wills are done and their funerals have been prepared and their caskets picked out already to avoid some of the conflicts with their family members. We also have we have a very active mosque here in Harlow. Where there's a lot of conflict for the families and the preparation for the families for repatriating the bodies back to West Africa in particular. Also in washing the bodies and taking care of and preparing the bodies for burial. What we did talk a little bit about were some of the challenges that do exist out in the community. Certainly language is one issue. Also the differences in the various hospital arrangements, healthcare arrangements, and a lot of times even the clergy aren't that well informed about all these new arrangements, and going forward there's going to be plenty of new arrangements given the changes in healthcare laws. So it's really important for clergy and chaplains and other healthcare professionals to be put to understand what each of the role of what they do. And also it helps in terms of the advocacy for the people for the faith leaders in terms of who do they advocate for on behalf of their own parishioners. And in terms of opportunities, great opportunities out there. We talked a little bit about identification cards where it would be helpful to put one's religion and one's wishes and who they should be contacting in case of death. Bob Wolf reminds us one more time that NILAD happens to have such a program, and once you take advantage of the program that NILAD is administering, and we can provide you with contact information on that. Also, telling your children and working with your teens and your children and have the conversation about death and dying. That's an important piece of it too, to better prepare. So those are some of the things. Bob, is there anybody else from the group? Anybody else want to add anything to it in terms of wrap up and everything like that? Okay, thank you.
Any questions? Okay, group number 7.
Hi, so I represent apparently a little bit of group 6, which seems to have gotten sprinkled all around, and also group 7, which was Queens, upstate New York, and apparently beyond. So in discussing efforts, challenges, and opportunities, we ended up dividing our discussion really into efforts and challenges and opportunities and policy. So in terms of our efforts, we all came from small congregations, most of which had either part-time clergy or super part-time clergy. We had one church that had members from the tri-state area whose pastor has trouble even keeping track of who needs care. We had a really part-time clergy quarter-time, where congregation members can report in, but if they're not in church, if nobody knows, some of the same issues all the groups talked about. If no one knows, there's not a lot that can be done. Our congregations also are aging. And when you have part-time clergy and need that outweighs the actual potential providers, that really became problematic, at least in our conversation. So in terms of, so those efforts obviously also embody the challenges, but a further challenge that we noted was really the variety of needs. So for example, people who are at home can't take care of their home anymore, but they don't qualify for a home health aide. They don't qualify for care of any kind. Or substance abuse, drug abuse, the variety of needs is problematic. So when we started talking about opportunities, we had a real overlap with policy. One of the possibilities that we discussed was something called an under-shepherd program, which is a group of lay people that stays in touch with those not in church. We talked about something that hospitals and parish nurses already do, that doctors and nurses could perhaps, doctors and nurses from within the community. So now you're talking about people who know their relatives, their friends, their neighbors, that perhaps doctors and nurses could staff a clinic every 3 months and do basic healthcare screenings and try to get people into a network and a system. Similarly, to have doctors, nurses, chaplains, social workers do the kind of trainings that we got here today. Although to also include other things, such as how to track your medications, to keep track of who your healthcare aid is from, what company they come from, things that people end up going to hospitals and having absolutely no idea what's going on. We talked specifically about communities, religious communities, combining forces with other houses of worship to create something community-wide. So both groups of lay people and groups of clergy. And then when we started talking about the role of policy and the role of government in care, and so there's that conflict between the notion that government cannot do it for everyone, but also the fact that we live in a city, many people live alone, there aren't, we don't necessarily have all the resources that we want. And from there we moved to political advocacy. We talked about targeting individual small communities, so for example, putting information about, let's say, advanced directives, putting that information in, for example, Chinese language newspapers. We talked about, I do have her name, as Sheila Nam was talking about, we talked about we ourselves doing our own individual advanced directives and then trying to get one other person to do it with us. And then finally, we ended with the question of how do we lobby and whom do we lobby and what do we lobby for? Whoops.
Anyone want to add or any questions from the group? Thank you very much. Group 5, I think. Is group 5 the last group? Has all the other groups reported, or?
Number 10.
Number 10? Okay, number 5 and then number 10.
Hi, can everyone hear me? Am I in the microphone right? All right, so group 5, a lot of what we did when we were speaking was telling stories, and challenges and opportunities were arising out of the stories that we were telling. We had sort of this ethos among all of us of shared responsibility and of needing to involve an entire community when we're talking about our congregational communities. We spoke about the necessity of there being honesty about how blessing changes as we age and get closer to death. We talked about not using the phrase end of life because language is important. So speaking about changes in life or beginning your new life may work better in some contexts. We spoke about how loneliness kills, and so not abandoning people, not abandoning our elders in particular, but also not abandoning our single people. We talked about keeping people in community, that when there are crises in people's lives, making sure that they are not falling by the wayside because they are now homeless, or because they are in a different school, or because they have had to move around and can't easily get to worship with us. We talked about collecting the oral history of our elders as a way of honoring them, and also about transmitting culture from generation to generation, having people teach each other important cultural practices about dancing or singing, and have the older people and the young adults and the children all dancing together. One issue that came up was how do we learn as communities to do healthy bereavement? How do we address the grieving that goes on throughout life, not just at the time of a person's death, but at times of crisis, and how do we manage the grief over our environment, for instance, or the loss of a job. Do you want to read some of them? I'm doing it. I don't. I have this wonderful man who's standing next to me. I don't want to ignore him. We spoke about how some congregations have health discussions and workshops that address issues like diabetes, but don't address care as people are getting sicker and sicker, and don't address advanced directives. And so that if we have regularly planned discussions about health and health care, that adding into the rotation discussions about advanced directives and planning would be useful. That we absolutely need to talk about geriatric care. That we absolutely need to talk about geriatric care. This is not something that we said, but I'm going to say it now. People are afraid to talk about dying, and people are afraid to talk about aging because it sounds like dying. So that's something that would be very greatly, it's something that we can work in our communities to try to address, to make it less shame-ridden, and to make it so that this is part of life rather than the end of life. And another thing is having a standard of support for everybody in our congregations. So that if we, that there are young people who also need to be talking about care planning and also need to have accompaniment to doctor's visits. And that we should absolutely be accompanying our elders to doctor's visits, but also be accompanying anybody who is single or who is facing a diagnosis that they or their family could find themselves in a crisis about. We need to continue to promote education and curiosity and continue these discussions. We need to take individual responsibility for this and also bring it into our leadership team so that everybody has some more responsibility about it, take it and pass it on. And that we need to just foster connections among people. Keep fostering connections, not let people fall through the cracks. And we were sort of talking about it in ways of, if we know that somebody's not sitting in church with us, that we reach out to that person. But that there are ways to structurally sort of help that out. That having smaller groups that work together, or having people who are sort of spotters would work. Do you have anything?
Well, I'd just like to add that Reverend Pitts was kind enough to extend an invitation for us to develop a partnership with CTAC. We can't do all this wonderful work alone. Mm-hmm. So we're going to employ your guidance, sir.
Thank you.
Great.
Thank you, everyone.
Thanks.
I am blessed to have a parent who is, my mom is 103, and she functions cohesively right across the board. And I've had my wonderful dad, who happened to pass away at 89 years old. But most persons within our communities do not have such luxury, because most of our families have challenges. And this is why this forum is so important, such a learning tool. And part of the questionnaire is that how many persons new we have met since we have been here. I said I've met all of you, and it's really refreshing.
Thank you, Nathan, and with the rest of Group 10 want to join us here, please come along. So we also began with a lot of storytellings and getting to know each other, and we soon realized that almost everybody was from the Bronx. And so it became really clear that there is an opportunity to come together as a community. And in the stories, there were many positive stories, and from each of us. And it left us with the aspiration of thinking about, so how do we transfer these wonderful personal stories into a community. How do we spread this? And the good stories involve a caring process that is compassionate, that is about kindness, and that is about coming together. And so we quickly, in terms of thinking about opportunities and challenges, began to think about, so how do we take that forward? And Nathan came over with a smile and said, wow, I've never met this many wonderful people, and we should just begin a work group. So I think there is the beginning of an action network here in the Bronx and perhaps beyond. And what we talked about is maybe a framework for this is to start with a nucleus of positive change. And through the partnership, we'll form tentacles. And so that is the structure that we're striving for. And in the community, there are many challenges. There are challenges with access, economics, emotional, many layers of needs, and but the team is empowered. And I think that this team is committed to coming together to think about ideas and to begin the work of implementation. Soledad mentioned that Brett talked about that this conversation has been happening for 30 years. And this group is not going to wait for another 30 years. So that's some of the inspiration from this group, and I'm going to turn it to the rest of the team if I need comments. Please say something.
I don't have much to say. I just like to add one thing. The key word here is team. There's no I in team, and we have to learn how to communicate and stop waiting. We have a habit of waiting to the last minute or waiting for something to affect us directly before we get involved. And I'd just like to leave you with this story. There's a story about someone asked Peter, is there a heaven and a hell? And he said, come with me. And he took them into one room, and in this room there was a table. And on this table was the biggest feast you could ever imagine. And there were people sitting on both sides of the table. The problem was that one of their arms were tied behind their backs, and the other arm had a long-handled spoon on it. So every time they tried to feed themselves, they couldn't. So their faces were all shrunk in. They were all shriveled up. So the person says, oh my God, this must be hell. So then he said, come with me. He took them to another room. And when they got into this other room, same situation. There was a table with the biggest feast spread out, people on both sides of the table. But these people, their faces were full, they were smiling, they were happy. What was the difference? They were feeding each other across the table. The people on each side of the table were stretching out that long-handled spoon and feeding each other. So that's what we need to do. We need to feed each other. Feed our communities. Feed our loved ones. Don't wait until they're dying to feed them. Feed them, empower them with knowledge, empower them with the information. Because there's no I in team. And team stands for together, everyone accomplishes more.
Thank you very much. Any questions? I see.
Well, it's not actually a question, but it's just to build on what I was reading there at the bottom. It says opportunities, shared experiences of successful partnership with families. And I just wanted to just share a little something that my wife and I do. My wife is a registered nurse. She works with, like you say, PACU, coming out of surgery and things like that. But making it a long story short, we both had struggles in our lives, and we had to go back to school. She went back at 42, and I went back at 46 because of our opportunities had shrunk. But As of today, because of the opportunity that we were blessed with and the opportunity to get ahead, we have opened our homes up to doing clinics in our homes. We just bring over families that don't have insurance, and I minister to them spiritually. I'm a hospice chaplain as well, but I'm more ordained minister, been serving the community for 20 years, but I just wanted to know how I can give back individually. And so with that being said, we open up our home to those who are less privileged at this time because of the healthcare system. And so I just wanted to share that with you. That, again, one, like you said today, just one at a time. One, you know, what can we do? And that's what my wife and I do. We give back to the community as well. I go into the prisons. I'm just very open to now being grateful, not being selfish at this time.
Thank you very much. And thank you very much, Team 10. We only have 5 minutes, and we have 5 minutes to work a miracle. Only 5 minutes. And no, I'm not a miracle worker, you are. But in the next 5 minutes, I would like you, and this is being recorded, so I'd like you to stand up, those of you who can help us to name next steps. I'd like to see 3 next steps that you feel that you want to take together collectively to deal with this issue of advanced care, wherever you are. So can we have individuals stand up and just say what you would like to do concretely? And if you don't want to do anything, that's okay, but I heard a lot of exciting things. Staten Island is in the house, and I'm really excited about what's going on in Staten Island. When I used to live here, I used to think Staten Island was this wonderful place of people that were multimillionaires. I know better now, and I knew that after before I left. But I'd really like to hear 3 things, 3 next steps that you want to do. Yes. Yes. I'll come to the mic.
What? Yes.
Come to the mic so we can hear you. But concrete things that, as a group, you'd like to do.
I think it's very important to get the message to more people. Yesterday, there were 400,000 people that got together in Manhattan for climate change. And I think that if we were to have a walk or something that gets the media involved with our ideas, or just gets more people aware that, you know, everybody's going to go through the end of life, whether it's a terminal illness, whether it's a terminal illness, I guess, right? So just a peaceful walk or something that will just, you know, get more people to see what's happening. And this is a very important issue because we're all born and we're all going to die. Thank you.
Thank you. And do you see that as part of a working group organizing that, or how do you see that happening? I think one group said that they felt that a working group or something should come together to do that. Do you see that as a possibility, or how do you organize this walk?
We should just set a date and do it. Okay. I mean, I think I'm not...
You don't want to plan it?
No, just set up a date and just go and walk, you know. Planning sometimes takes 30 years or a long time. A lot of times we plan and plan and plan, and when things happen, it's unpredictable. We don't know that tomorrow we might get a news from a doctor saying, oh, you're going to be moving on. We don't know. So sometimes planning is good, communication is good. Sometimes silent walks are good as well. Okay. Just getting together and seeing a message of peace out there. And these walks help a lot. They have cancer walk, AIDS, right? I just came from one, 300 miles from Boston to New York. Wow. 100 miles a day. They're out there. Thank you.
Thank you. Yes. Thank you, Sylvia.
Hello, everyone.
Hello.
As a Staten Islander, I am committed to start to dialogue in my church, in the Unitarian Church of Staten Island. So I am committed for that.
Okay. Anyone else? Yes.
Yeah, as a physician and addressing the advanced care vis-a-vis health issues, I've shared information with John. I can put the CTAC in touch with the two large national organizations, the Islamic Medical Association of North America and the Association of Pakistani Physicians of North America, and see if we can coax the boards to either join CTAC or at least work through their local chapters in terms of reaching out to the communities and propagating and promoting the advanced care initiatives.
Thank you very much. Anyone else? Yes.
I was actually only here for the last half of a day. My name is Courtney Buchanan. I currently serve as a hospice chaplain. I've served as a hospice chaplain for the last 8 years and currently serve as the spiritual care manager at VNSNY Hospice. I would just like to offer the opportunity that if there are as a church community, if you would like an opportunity for one of our representatives to be able to come out and just provide education about what hospice is, what we do, what we offer, I would be more than willing to help facilitate that. And to me, the education piece, whether it's through a walk or whether it's through these informal, small settings, whatever way that we can get information back and forth, to me, that is truly where the crux of part of our challenge is.
Thank you very much. We have just two more. I see two more people, and then we're going to have to go. And I just wanted to wrap it up real quickly because we have to be out of here at.
No, we're fine.
Oh, we're fine?
Yeah.
Oh, great.
At 5.
At
Let
5.
me give my face to the congregation. My name is Reverend Gene Wamalis. I'm a chaplain for Franklin Hospital, LIJ. There is a story from the Bible, Luke chapter 10, verse 25. There is a certain man come to Jesus. He asked him, what I should do to get to the kingdom of God. And Jesus asked him, what you read in the book? And he answered, he said, I read, love God, all your mind, all your heart, and your neighbor like yourself. Jesus asked the answer, he said, you answer correctly, now do it. And you will say, so what I see, people talk a lot. What they're doing is really not to what we should, everybody said today is nice, is good. But we have to stand up and put it on practice. Not talking about it, not, sing about it, or just doing it. And I'm in the hospital, I see a lot of need. There's a lot of need. If you want to work, you could work because everybody needs help. May God bless you, everybody. And I'm very happy I'm here. I hear a lot of things, good things, help me a lot. More you know, more good help. So, thank you very much.
Thank you very much. We are going to have to close, but let me say two things. One is I just appreciate so much you being here and participating in this process. And I really believe that the Holy Spirit has been moving during this day in ways that are beyond belief. We've been to many places across this nation and we have seen many groups. But I think this is the first time that we have been with a group that has had the kind of diversity and the kind of depth and the kind of understanding of this issue than you have had. And so we just want to thank you for being here and participating. And we commit CTAC to work with you to help organize and to help do what you feel needs to be done. I want to thank you at the Faith Center and the staff. I mean, they've just been tremendous. And one of the things that I always remember is that one of my professors used to tell me that Moses had a real problem because Moses didn't know the power that he had. And when he was on Mount Sinai, Moses was just all confused about that power. And the Lord said, well, Moses, what do you have? And Moses said, I have a stick. And God transformed that stick into a weapon of deliverance. And I think that you have sticks. Sticks that you cannot even imagine how powerful they are. But if you could just use your stick to the glory of the God that you serve, then I think you will be able to transform advanced care here in this city and help us to continue to transform advanced care across this nation. And so I want to thank you, and we're pledging ourselves to work with you. I hope that the idea of a working group will come to fruition, because I think that you have the breadth and the depth of having people from various communities come together and struggle with what it means to deal with advanced care from your own perspectives. And once you come together, there's no telling what you will be able to do. So I want to thank you, and I know John is here, who is our staff person, and I know he's excited about this. And Bob, we want to thank you for all of your support and your effort in this regard. And also Brad and Quay, thank you for also being a part of this. And thank you very much, again, the team from the Interchurch Center. God bless you.
Okay, we've had a very rich day, a lot of good exchange, and in this segment we're just going to do a couple of closing things. One is that we'd like to use this opportunity to see if if anyone wants to make an announcement about any information they brought or any resources that they think are relevant for people here that weren't already discussed. So, does anyone have any announcements? Sure. Yeah.
I didn't bring enough copies because there was standing room only here, but many of you received our magazine from Healthcare Chaplaincy Network. I'm going to, as Sarah said, it's okay, I'm going to send notes around. If you'd like other copies, you'd like to subscribe, also subscribe to our free e-newsletter. But also tomorrow, there was a card there, and if you check on our website, we started something for a mini retreat, as Elaine knows, who's a colleague at Healthcare Chaplaincy Network, a spiritual care rejuvenation for healthcare professionals, and we opened it up to the public. And it's going to be tomorrow at 8 o'clock at Kimmel Center. There is a $25 charge. If there's a card, which I handed out, but it's something that we came out of here is going to be, I believe, talking about different ways helping healthcare professionals, physicians, nurses, chaplains, clergy who are dealing with these issues. We all know, we talk about self-care and burnout. And it's at 8 a.m. to noon. And it's at Kimmel Center at NYU. If you don't have a card, it's in information on our website. I'm fairly certain we have open spaces. And I know I, for one, while I'm not a clinician and I don't deal with the stress that you do, I myself am looking forward professionally and personally to water and not. Thank you, Seth.
Yes, on October 25th, the New York State Chaplain Task Force, along with Visiting Nurse Services of New York, will be having an end-of-life presentation in Staten Island, and if CTAC would like to be a part of that, please let me know.
What day is that?
It's October 25th. It's a Saturday from 9 to 12.
By the way, if people have announcements like this that they'd like to share via the Interfaith Center newsletter, you can always email it to me. The newsletters go out at the beginning of every month, so if you can email me your announcement, we can include it and share it with their wider network of religious leaders.